This is the BBC.
This podcast is supported by advertising outside the UK.
Hello, I'm Mark Carney, and in my BBC Reith lectures, I'm going to chart how we've come to esteem financial value over human values, and how we've been moving from market economies to market societies. I'll argue that this has contributed to a series of global crises of credit, COVID, and climate, and I'll outline how we can turn this around. In my third lecture, I'm going to look at the impact of the pandemic and analyze how the COVID crisis is forcing us to confront fundamental questions about how we value health, wealth, and opportunity.
Welcome to the third of the 2020 BBC Reith lectures with the former Governor of the Bank of England, Mark Carney. Now, in his series, How Do We Get What We Value?, he is discussing how putting financial values above everything else has contributed to many of the biggest problems that we're facing today, including crises in credit, climate, and in this, his third lecture, COVID too. The pandemic, he observes, has forced nation-states to confront just how we value health, wealth, and opportunity, apparently forcing governments to choose between the life of its citizens and the lifeblood of the economy. Now, Mark's going to argue that this is a false dichotomy and that we should be moving beyond a narrow and financially driven reaction to COVID-19. The third of his 4 lectures is called From COVID Crisis to Renaissance. Mark, it's over to you.
Thank you, Anita, and thank you all for tuning in. Near the end of February, I sat in a gilded chair in the Al Yamamah Palace in Riyadh at my last meeting of the G20 finance ministers and central bank governors. After having attended these gatherings for 15 years, I was well familiar with their rhythms. The heads of the international organizations would warn of the risks from unbalanced growth, growing inequality, and chronic environmental unsustainability. Yet, as memories of the global financial crisis faded, ministers would often appear indifferent. They were increasingly scripted, rattling off talking points prepared by their officials. And the combination of jet lag, the immediacy of domestic politics, and slavish devotion to social media meant that few paid much attention when they weren't speaking. That day, however, something was different. Several ministers spoke in agitated tones of an impending catastrophe, heads snapped up from iPads. Everyone around the table was familiar with the coronavirus, then thought to be confined to parts of Asia. Some could even name its strain, COVID-19. But few were prepared for what would be required in just a few weeks in their own countries. And no one imagined how the professional and personal lives of everyone they knew, everyone on the planet, would be transformed, and how we would soon be confronted by fundamental questions about what we truly value. So how could this have happened? In his classic treatise, Leviathan, Thomas Hobbes described back in 1651 how the fundamental duty of the state is to protect its citizens from violence. Over the centuries, the government's role as protector has been extended to areas as varied as promoting financial stability, protecting the environment, maintaining data privacy, and yes, preparing for pandemics. To some people, these are essential public goods. To others, this is the creep of the nanny state. Last year's Reith lecturer, Lord Jonathan Sumption, even argued that we have developed an irrational horror of death, leading us to protect lives at exorbitantly high costs that previous generations didn't contemplate. In the event, states failed in their duties to protect, and now the COVID crisis is forcing us to confront questions of how we value health, wealth, and opportunity. Looking back at the initial response to the catastrophe, something is striking. Governments and citizens drew on their core values and made decisions based on human compassion, not financial optimization. Governments prioritized the health emergency and then tried to address the resulting economic consequences. The economy was put on life support in order to save lives. Governments have asserted a level of control over our everyday activities that has surpassed anything in modern history. In many countries, leaving your home to exercise or visit family members has been prohibited. People have been deprived of their livelihoods. Staying at home during a lockdown or wearing a mask following government guidance is part of the Hobbesian bargain, obedience in exchange for protection. Many are willing to comply with decrees of a legitimate and trusted power, but such state legitimacy must be continually earned. Compliance will be undercut if concerns develop about fairness, administrative competence, or the validity of the strategic objectives themselves. Most people across the globe have supported lockdown measures and massive government spending even if they perceive little personal risk. And they've gone well beyond compliance to active charity, sewing masks, delivering food to the vulnerable, becoming NHS volunteers, and cheering the heroism of frontline workers. Authorities, in turn, have drawn on this spirit of altruism by emphasizing the good that social distancing does for others. The willingness and at times eagerness of people to help their fellow citizens has come at great cost. Lockdowns deepen economic uncertainty, disrupt social lives, and bring incalculable levels of stress and anxiety. Solidarity in a pandemic is an example of positive behavioral contagion. If those around us observe lockdown rules or wear masks, we're more likely to do so as well. This concept, which can be also termed a social meme, goes back to the moral sentiments of Adam Smith. And it reminds us that virtue is not a finite resource to be conserved, but a value that grows with use. At the beginning of the pandemic, many said that this tragedy underscored our common humanity. Put another way, we are all in the same storm. It quickly became apparent, however, that we were in very different boats. COVID is fundamentally unequal in its impact, and it has exposed deep inequalities in our societies. The virus targets older populations, those with pre-existing conditions like obesity, hypertension, and diabetes. In the UK, men in low-skilled jobs were found to be almost 4 times more likely to die from COVID-19 than professionals. In England and Wales, the mortality rates for Black, Pakistani, and Bangladeshi people were nearly double that of white people, and the same grim ratio holds for African Americans. The economic impacts of containment measures also fall differently across populations. Lockdowns have decimated jobs in service, hospitality, and entertainment industries. In the UK, nearly half the jobs that were at risk of permanent layoffs were those with wages of less than £10 an hour. The increases in unemployment affect the young, minority ethnic communities, and women to a materially greater degree. Closure of primary and secondary schools will undermine equality of opportunity in the years ahead. Education under lockdown depends on parental guidance and access to computer and good broadband, reinforcing the structural advantages of children coming from richer households. At the height of the spring lockdown, the UN estimated that approximately half of the 1.5 billion children out of school did not have access to a computer. The cost of these inequities will mean greater income disparities and higher unemployment in the future. The young will pay a significant economic price, and that's even before the possibility of higher taxes over their lifetimes to fund the current emergency. As the costs of preventative measures grow, so too does the imperative for a clear strategy that values life, opportunity, fairness, and sustainability. One of my mentors when I was starting in finance was Jerry Corrigan. Tough as nails, Jerry was in charge of the New York Fed during Black Monday in 1987, and that was the day the U.S. stock market crashed by its largest fall in history. During the volatile days that followed, many clamored for trading to be halted. The market, it was said, had taken leave of its senses and needed the equivalent of a child's time out. But Jerry would have none of it. In his view, the problem with closing the market was that you would have to open it again. As military leaders know from a young age, and many politicians only learn at their cost, starting a war is easy, exiting the field of battle much harder. Having closed the economy, how could governments safely open them again? Many frame this decision as a trade-off between health and economic outcomes. And this demonstrates in the starkest terms the importance of understanding the relationship between value and values. Now, there are ways to turn this decision into a pure calculation using techniques such as value of statistical life and cost-benefit analysis. And these weigh the current and potential future economic damage against estimated monetary costs of increased ill health until the marginal costs and benefits of death and commerce are equalized. Now, valuations of life are not a new concept. The Prophet Muhammad endorsed a compensation of 100 camels when the life of a free Muslim was taken. Under old Anglo-Saxon law, the perpetrator of a murder owed the victim's family an amount based on the wealth the victim had accumulated during their lifetime. In the 17th century, Sir William Petty put a value on life in order to measure England's national wealth. He valued the population according to an estimate of the average annual labor value multiplied by 20 years. This resulted in a figure of £80 per head, which Petty noted could be used to estimate national losses from events like plague or war. During the Industrial Revolution, crowded cities and unsafe working conditions led to the development of wrongful death claims and the proliferation of life and accident insurance. As with Petty's calculations of national wealth, the focus of compensation of insurance companies and the judgments of courts remained on lost future earnings. Valuing life this way makes sense when the objective is to ensure the deceased family remains financially secure. But the shortcomings of the approach become evident when we're assessing the desirability of preventing death. If we only cared about the financial security of survivors, we'd never spend any money to save the life of retirees or those permanently out of work. In a similar vein, in the early 1950s, the Rand Corporation realized that the value of the lives of Air Force pilots was greater than the cost of their training. Even Dr. Strangelove could see the difference between intrinsic and replacement value. These limitations ultimately led to a change in the valuation of life that has many parallels to the subjective value revolution discussed in the first lecture. In a seminal article in 1968, the Nobel laureate Thomas Schelling shifted the valuation from those left behind to those who would die. Schelling's second insight was that calculations didn't need to value life, but instead they needed to value the postponement of death. Schelling realized that people's preferences could be determined by examining what people were willing to pay to reduce the risk of death by some extremely small amount. And to answer that question, he suggested conducting surveys and looking at existing prices for taking and avoiding risks. An example would be a wage premium for someone who takes on a dangerous job, or their spending, such as buying a helmet, which reduces the probability of a bad outcome. These different methods lead to surprising variance in the value of statistical life across countries. A Canadian life is worth between 3.3 and 9.9 million Canadian dollars. The European Commission rates a European life between Euro 1 and 2 million, and the UK Department of Transport uses the disturbingly precise figure of £1,638,390. Americans are valued between $1 and $10 million, with the average trending upwards at a rate that rapidly exceeds inflation. America isn't just great again, it apparently never has been so great. Today, public policy decisions around the world use values of statistical life and the related concept of quality-adjusted life year as part of what has been termed the cost-benefit revolution. The attraction of doing so is that financial values encourage clear decisions. The question is whether this clarity is justified and whether it reflects the values of society. And is it appropriate to apply it to such a comprehensive a challenge as COVID? We put a value on pain when, through the market, we set a price for aspirin. And we put a value on pleasure when we set a price for Pepsi. To Schelling, the intangible qualities associated with life weren't that different from other consumer goods. Now, I disagree, and there's 4 reasons why the value of life is radically different. First, unlike consumer goods, life is what economists term a non-positional good. That means no part of life's value stems from the ownership of comparable goods by others. We do not feel any better off when those around us have less life, though there is evidence that shows that we often do feel better off when we have a nicer car or a bigger house than our neighbor. Evidence also shows that workplace safety and risk of death are valued in absolute terms. In other words, people will support measures that increase their life expectancy, even if it increases the life expectancy of others by more. It may seem odd to have to state it, but life is different from Pepsi. Second, Schilling's faith in the wisdom of crowds can be questioned. Estimates of the value of statistical life rely on assumptions about markets and human nature that are seldom, if ever, realistic. It's difficult to believe that a person taking on a higher risk job knows the occupational probability of death and rationally analyzes this probability against their wage premium. Moreover, can the frailties of human behavior be overcome by the law of large numbers? To put it bluntly, would we be in our current predicament if we valued mortality consistently? The cost of pandemic preparedness was less than 2 days of lost output from the lockdown. What's more likely? That we radically increased our valuation of life this year, or that our human frailties, including present bias and confirmation bias, meant that we underinvested in resilience as a society? Thirdly, there are moral issues that transcend these methodological flaws. In classic utilitarian fashion, methods of calculating the value of life aggregate individual preferences without considering their distribution. Those in their 50s report a higher value of statistical life than those in their 20s, as do people in advanced economies relative to those in developing economies. Are we comfortable that policies should be made accordingly, maximizing wealth, not welfare? Moreover, while advocates of herd immunity suggest shielding the vulnerable groups, like the elderly and those with comorbidities, what of socioeconomic groups that are more likely, and in fact most likely, to catch the disease and more likely to die from it? I'm unlikely to catch COVID working online, but those who deliver my packages, prepare my food, and provide me with health care are consistently and constantly exposed. The path to herd immunity runs directly through the inequalities in our society. Finally, monetizing life ends up trivializing the very values that make it worth taking the decision in the first place. As we saw in the first lecture, calculation can corrode. As weeks turned to months and the prospect of a return to normality receded into the distance, 3 things changed. First, the economic costs began to mount, with government deficits reaching levels not seen since the heights of the Second World War. Secondly, prolonged inactivity began to erode the productive capacities of workers and companies. And finally, the unequal impacts of the pandemic on women, minorities, and the young, and on the broader welfare of the population, including on mental health, domestic abuse, and the non-treatment of other diseases, became increasingly apparent. And this renewed calls for explicit trade-offs between health and the economy. It's not clear that these are best answered by cost-benefit analyses that can be fraught with dubious assumptions, flawed methodologies, and hidden inequities. More practically, we need to resist the siren call that there is a trade-off between the economy and our health. As my former colleague at the Bank of England, Jan Vallega, has documented, there's extensive cross-country evidence that these objectives are complementary. As but one example, data from various countries indicate that more than 80% of the reduction in mobility has been voluntary as the prevalence of the virus increases. Recent surges in infection rates have undermined consumer confidence, slowing the recovery. The fact is, people are reluctant to go back to work or to the office or to go out to spend when they're concerned about their health and that of their friends and family. The lesson is that we need to either control the virus or credibly lessen its impact on people's health. So how should we proceed? As advocated by the economists Nick Stern and Tim Besley, the ideal is to define our core purpose first and then determine the most cost-effective interventions to achieve this goal. Such cost-effectiveness analysis explicitly seeks to achieve society's values. I've argued in the wrong hands. Cost-benefit analysis can help determine them. During the pandemic, people have prioritized the values of solidarity, fairness, and responsibility. And this suggests that COVID policy should be centered on health and social outcomes, minimizing the risks of death, ensuring that the sick have adequate treatment, and buying time for better treatments and vaccines. The burdens of social distancing and the benefits of any state protections should be shared fairly across society. And once these objectives have been achieved, policymakers should seek to maximize the benefits to welfare and minimize the threat of a resurgence of the disease by selectively opening up. It does make sense that the unifying objective is targeting a low R, or reproduction number. Said another way, the average number of people infected by any individual with COVID. R brings public health and economics together. Relaxations of restrictions increase R with economic, health, and social consequences. A strategic approach to COVID is the best combination of policies to achieve the desired level of infection control at minimum economic cost, with due respect for inequality, mental health, and other social consequences. And calculating those costs then provides guidance when considering different containment strategies. That means paying attention to the impact of measures on fairness, the social returns to education, intergenerational equity, and economic dynamism. In deciding which sectors of the economy to open or close, policymakers must weigh up externalities, in other words, the spillovers from one activity to another. There are classic economic externalities, such as when car production increases the demand for steel. But there are also infection externalities, such as when the opening of one sector of the economy, like hospitality, increases the spread of the disease. Policymakers should restrict economic activities that have weak economic externalities but high infection externalities, and open or even subsidize those with low infection externalities and high and positive economic externalities. Obviously, the biggest challenges are in those areas that are essential economically, but also highly risky from an infection perspective, like healthcare, essential travel, and education. Legitimacy and fairness demand that we should take into account how the disease and the economic shocks hit different parts of society. As I said, COVID affects the old more than the young. It hammers industries prone to spreading the disease, like hospitality, while reinforcing the competitive advantages of those that do not, such as e-commerce, e-learning, and e-health. This means that alongside broad-based support programs, we need ones targeted at specific sectors of the economy and segments of the population. This isn't about picking winners, it's a reaction to COVID choosing losers. In the same vein, fair access to healthcare is essential. If it's compromised, the bonds between the state and citizen will be undermined, and as a consequence of that lower compliance, worse health and economic outcomes. And the same goes for perceived fairness in terms of the privations experienced during lockdowns and social distancing. There cannot be one rule for the powerful and another for the rest. Managing COVID is a dynamic process. Decisions taken early on when information was limited and fear rampant shouldn't be set in stone. Policies must be recalibrated with new developments, such as improvements in testing, better therapeutics, and the prospects of a vaccine, developments that change the risk profile of the disease. And with the buildup of debt, the eroding skills of workers, and the rusting of idle capacity of firms, our resilience is diminishing. It's also becoming critical to address in many countries disparities in education. As the crisis is accelerating technological change, we will need to support increasingly workers over jobs, promote the creation of new companies, and ease the exit of those businesses that are no longer viable. Finally, we need to spend public money wisely. It's not unlimited. This isn't about a return to austerity, but rather about more effective spending by supporting education and skills and the productive capacity of businesses. In short, we will need in time to begin to move from redistribution to regeneration. Now, the G20 will meet again later this month on Zoom. This time, leaders will have to look into their iPads to see rather than avoid each other. The COVID crisis has revealed the importance of the state and the costs of its failure. Governments undervalued resilience in the years leading up to the crisis, failing in their duty to protect their citizens. People across the world rose to the occasion, displaying their values of solidarity, fairness, and responsibility. But at the same time, the COVID crisis has revealed deep strains in our societies. Essential workers have been undervalued. There's a stark contrast between the solidarity in the crisis and those deep inequalities. After decades of risk being steadily downloaded onto individuals, the bill has arrived. Entire populations are experiencing the fears of the unemployed and sensing the anxiety that comes with inadequate or inaccessible health care. And all of these developments have rightly raised expectations for fairness and greater equality in all spheres of life. And this points back to a deeper issue that comes across these lectures. In recent decades, subtly but relentlessly, we've been moving from a market economy to a market society. Increasingly, to be valued, an asset or activity has had to be in the market. And this crisis could help reverse that so that public values help shape private value. When pushed, societies have prioritized health first and foremost, and then looked to address the economic consequences. In this crisis, we know we need to act as an interdependent community, not as independent individuals. The values of economic dynamism and efficiency have been joined by those of solidarity, fairness, responsibility, and compassion. Many of those G20 leaders have described the current crisis as a war against an invisible enemy. When the war is over, we'll need to win the peace. How we address climate change will be the test of these new values. After all, climate change involves the entire world, from which no one will be able to self-isolate. It's a risk today that's predicted by science to be the central scenario tomorrow, and it can only be addressed if we act in advance and in solidarity. If we come together to meet the biggest challenges in medical biology, so too we can come together to meet the challenge of climate physics. And how we do so will be the subject of my last lecture. Thank you very much.
Mark, thank you so much. Another incredibly thought-provoking and timely lecture from you. Let's take some questions from our virtual audience now. We can start with Howard Davis, Chairman of the NatWest Bank, former Deputy Governor of the Bank of England. Howard, what was the question that you wanted to ask?
Yeah, I'd like to just pick up on what you said, Mark, about solidarity, fairness and responsibility. And you kind of contrasted that with this rather hard-edged cost per job, cost per life calculation, which you didn't like. And I thought those were some important points. You then also said, well, we have to manage this dynamically with an objective. Now, my perception, this isn't particularly a banker point, actually, is that at the moment, it's not quite so clear that we have as robust a solidarity, fairness and responsibility as we did have earlier. When I get on the tube, quite a lot of people are not wearing masks. My local shops have defined essential in rather curious ways. So the local picture framer is open. I mean, I'm as fond of art as the next man, but I'm not sure I would classify that as an essential service. And to some extent, you hear that people are bending these rules because they're just uncertain now as to what the objective is. How do we balance this need for a dynamic approach with nonetheless giving people some certainty that there is a kind of rational way through this? Because I've got to confess that I'm not sure that that's where we currently are.
So there's several elements of the answer, not all of which are in place, which is leads to some of the dynamics you're talking about. I think on balance, though, I would come down in terms of compliance in the UK, certainly compliance in Canada, is still at the solidarity end of the spectrum, but arguably not as to the great degree as it was in the spring, which may be your point. But competence comes to this. Part of the trust and authority goes to a competence point. How well is the strategy being executed? Secondly, reaffirmation of what the objective is and why the objective is important. Thirdly, and this is almost the most difficult bit, is we've learned this about certain protective activities that we thought were ineffective. For example, we were all told that masks were ineffective initially, and that had to be admitted that was a mistake. Actually, it was one of the most effective protections. Or that certain sectors of the economy, based on data, are not as risky as we had previously thought. And I don't want to talk about specific countries necessarily per se, but that element of it has not been as clear. Last point, I think what also people struggle with is, as we all know, test and trace regimes. And the challenge one has that if it takes a very long period of time to find out whether or not you have the disease or someone next to you has the disease, there is a greater reluctance to go to get testing and then to comply. And I tell you, in my native Canada, I know I'm going to get a couple of colds over the course of the year, because I always do, because it's cold in Canada. And I'd like to know pretty quickly whether I've got a cold or COVID, as with the people around, because I've just bought myself another month in quarantine, and I've got 6 weeks of quarantine and running already just from moving back and forth between jurisdictions. One thing that is exceptionally difficult to communicate, but not to you, is Bayesian probability. So after a certain period of time, if you test somebody and they don't have COVID, they isolate, you test them 5 days later and they don't have COVID, the probability that they do is not zero, but it's relatively low. And bringing that element into it and explaining that actually can have a significant effect on the types of activities we can have.
OK, well, let's go back to Howard Davis for a reply to that.
No, I think that's right. I think the difficulty possibly is that if that's where you wanted to be, we wouldn't start from here. Yeah. But I think nonetheless, I take your point that a redefinition of the objective and of how the trade-offs are made would be still useful now. Yeah. And I also would add that it should be possible to bring in other types of social science expertise. One can't help feeling that SAGE has been heavily weighted to epidemiology, very important, clearly. But nonetheless, some of the points that you're making about the balance, even if you reject a simple trade-off, which I think is right, between sort of health and the economy, nonetheless, your speech was shot through with examples of where there are awkward trade-offs and awkward balancing decisions to be made. And I think the government probably needs a broader spectrum of advice on how to make that. And I think that would still be worth doing now, because we've still got quite a long way to go.
Let's get a question now from Steve Baker, who is a Conservative MP. It is a Conservative government that we have in power here in the UK. A Conservative MP for Wickham and a member of the Treasury Select Committee. First of all, just getting the reaction, we wouldn't want to start here. Sounds a little bit like an indictment of how things have gone so far. Would you like to react to that, first of all? That we are not in an ideal situation. And, that happened on your watch.
Well, yeah, of course, I'm not a government minister, but what I would observe is that no one saw this pandemic coming. Indeed, the manifesto on which we were elected foresaw having plenty of money to spend. And if I may, can I get on to the question that I wanted to ask?
Sure.
Mark reminded us that public money is not unlimited, but the pandemic's accelerated a phenomenon we've seen over the last decade. It's become the norm for governments to issue debt, and for another part of the state, the central bank, to buy that government debt out of newly created money from nothing. With this money, the government pays its obligations. Now, I would say this encourages people to believe it's possible for there to be such a thing as a free lunch. So, as with the moral hazard created by the government bailouts of the banking system, to what extent will this QE, quantitative easing, create moral hazards in our society in future, whereby it becomes an openly acceptable premise that there is such a thing as a free lunch?
It's a very important question, and it goes to the heart of the institutional structure of the Bank of England, which the Conservative government helped put in place, which is that you have independent committees of the bank that make these decisions ultimately accountable through Mr. Baker and Treasury Select Committee through Parliament to the people, but very much held to account on that. And what's critical, and I think my former colleagues are making clear, that they are independently making these decisions because they think for the pursuit of their monetary and financial stability objectives that these purchases, the quantitative easing, is the right thing to do. And at present, the government's fiscal policy and the policy of the central bank are in alignment, they're reinforcing, but depending on the outlook for inflation and moral hazard and other risks in the financial sector, is that they can come into opposition, and that's where the test of the independence.
When you say moral hazard, what exactly are you meaning there?
Not you, maybe me. When I take a rental car and I have insurance on it, I'm less careful with the rental car. When you provide insurance to somebody, it changes their behavior.
Let me go back to Steve Baker here, because it's one of those things that we heard, there is no magic money tree, and now we seem to have discovered a magic money tree. Is your worry that culturally we can now not undiscover said magic money tree?
That's absolutely right. I do think what we've seen here now is that government finances are where they are. We're able to finance this deficit because of the extent of QE, and I think that is teaching the public that there's a free lunch, that there's something for nothing.
Steve Baker, thank you very much for your question. Let's go now to Sophie Harman, Professor of International Politics and an expert in global health. Before you ask your question, just your reaction to that.
Okay, well, I would push back slightly on Steve Baker's point in that we didn't see this coming in the first instance. Pandemic threats are detailed in the government's national security plan. And there are lots of lessons we can learn from outbreaks around the world that were not necessarily taken on. One of those lessons has been around care. So that's formal care work in care homes and also the informal care work that you see happening in homes across the country here in the UK. So really what I wanted to ask was that COVID-19 has really exposed the care crisis in the UK. If we're talking about values and what sort of values we want in society and our economies, how can we build an economy that values care?
It's a great question. I think part of what we've seen is the value that people have put on, including in a non-personal way, on the elder generation. So if we can bring ourselves back to March when this was erupting, in effect, the information was it was bad, but it principally affected the elderly, and the response, which was well in advance of the actual government lockdowns. I mean, you see actually in mobility data and other people started to respond to it, and a lot of the response was Rawlsian. In other words, it was taking care of others, even though you were unlikely to be directly affected yourself. I mean, my argument in part is there is a revealed preference, which is to the credit of the country, the people in the country. Then the more challenging thing is, okay, well, what do we now do with that? Because we do have and it's the same in Canada, the performance in the care homes, that's 90% plus of the death or thereabouts have been there tragically. So what do we do to invest more effectively in care, knowing that this issue is only going to increase given the demographics, which requires a rethink? And I think you know better than I, Sophie, but even I was aware of it, is that tough issues around care have been dodged effectively over the course, particularly in the last 10 years. Again, we have a window here where big issues around resilience and solidarity that we as humans want to put off for another day, and as a society we want to put off for another day, includes sustainability, includes care. Now's the time. They're on the table. What are we going to do about it? How do we prioritize, and how do we reset? And that's an easy question to ask and hard to answer, but we should take the opportunity because it's all there.
In a similar vein, we've got Kaz Reith, who is joining us from our virtual audience. Kaz, can you hear us?
Yeah. Will the apparently putting the economy before the health of the nation in the USA lead to major international economic repercussions?
I think there are a few repercussions of the U.S. policy as a whole internationally. One is that I would argue that the U.S. economy will be weaker in the next, certainly next 6 months than it would have been if the disease had been properly handled. And then measures, harsher measures, as we've seen in a number of countries, have to be ultimately taken to get the disease back under control. And so that will have economic impacts, absolutely. I think the second point, Kaz, is that the global response, in part because of a indifference by the United States to a global response to COVID, has not been up to the task. That will mean weaker economies and a weaker recovery in emerging and developing economies because they just won't have the resources. They don't have the resources today, and it could be a slower rollout of vaccines when they come there. And there is a human element to that. It's humanity. But there's also an economic element to it, and there's also a disease element to it, which is that the longer we have COVID coursing around the globe, the more likely it is to mutate, and we have subsequent waves and bounce back. So the global response is not in place, and one of the big tests of the U.S. administration, all administrations, will be not just getting on top of it domestically, but what we do internationally.
Well, we've got a representative here from the Confederation of British Industry, and Rain Newton-Smith is chief economist at the CBI. Rain,
what really resonated with me about what you were talking about was the role of value. And I think we've really seen since the beginning of the pandemic, businesses have absolutely made decisions, based on human compassion. How can I protect the health and well-being of my staff? How can I save as many jobs as possible? How do supermarkets, how do they get food to the vulnerable? And I think the scheme, the furlough scheme, the bank loans were such lifelines for so many. And some businesses were really struggling to survive. But I think now that we're at this stage of the recovery, and this really builds on what the previous caller was asking about, as we consider what we value in our communities and in our lives and the wider planet and our biodiversity, I think the question becomes not just about how we help businesses to survive, but also how we help them to thrive sustainably. And how can we create those jobs that you talked about? How do we move towards that regeneration, particularly for our young people? So I think my question to you, Mark, is really how do we help businesses invest at this time when uncertainty is just so great?
Yeah, it's the question in many respects. And part of it is providing reassurance that the biggest risks that could come from this, which I would argue is too rapid withdrawal of stimulus, that's not going to happen. That's the first thing. I think the more important thing is, in partnership with business, pointing a direction for the economy, a few directions. What is the economy of the future? What have we learned from this process, and where's the economy going? I mentioned before more platform, online-based. I mean, it's an obvious point, but what does that mean for the jobs of the future, and how do we support that in a broad sense? And I also mentioned on the sustainability side, so that if Rain and I are running a business, we can invest in the direction of whether it's the hydrogen economy, whether it's carbon sequestration or other aspects, or just understanding about where electrification and other low carbon is going to happen in this economy. And now is the time when those big decisions need to be taken, and they're not all spending decisions. A lot of them are regulatory decisions.
Well, I know we're going to return to this subject because your last lecture very much focuses on that. Rain, thank you very much indeed. Can we talk about individuals now? Because, for people who are at home trying to pay their rents, trying to buy their food on less money. Well, let's take a question from Chris Nayland, our Chief Executive of Birmingham City Council. And Chris, tell me what your concern is for those people who power the economy, but at that level.
What we've, I guess, seen in the last 6 months or so are those structural inequalities that you were talking about, Mark, that have been hidden in plain sight for many years and that have now been kind of revealed by COVID. And those barriers, those inequalities that people feel are very much driving demand for services that we are increasingly struggling to be able to afford to provide in the ways in which we've traditionally done so. So I guess my question really coming out of all of this and in response to what you've been saying today is the appetite for the kinds of public service reform we're going to need to see in response to those challenges that you've talked about. And I suppose the context is, quite aside from kind of the many more years of fiscal restraint we're likely to be seeing, the kind of profound frustration that many of us on the front line feel about our ability to innovate and support people in new and novel ways, which incidentally are potentially more cost effective, that both build on and draw on the solidarity of which you've been talking about today. And the challenge, I guess, is essentially we are working within models of public services that were kind of designed by our great-grandparents' generation to meet the needs and risks of their times, but aren't being built from first principles to address the kind of risks and issues of today's economy and society. So I suppose my point is, did policymakers understand that? Do they get the need for change and the nature of what that change might be?
Okay, so this is where the format doesn't serve us as well, because there's a lot more behind that question in terms of the substance that Chris knows and I don't. One of the small p political economy or social realities of this crisis is an opportunity for a social reset. What do we value and how are we going to go about it, achieving it? And given the solidarity which has been demonstrated, it really has been demonstrated spontaneously by citizens to their great credit, how do we bring that in to the system and how do we maximize it? That's the first point. One of the things that has happened with this is it's pulled forward change that was probably going to happen anyways in terms of, and again, I'll lean on the online economy and pulling forward elements of the, quote, fourth industrial revolution, okay? Whenever you have these big technological shifts, there's big impacts and they tend to exacerbate inequalities. You have to do massive retraining and retooling of your economy. And that which we probably thought we were going to do over the next 20 years, it's been pulled forward into this decade. And we really need to think about how we're going to do mass retraining and reskilling, which is a related point to what Chris is talking about, but absolutely additive. And so all of these decisions, it's not all about government spending, but it underscores the scale of what's required.
Well, Chris Naylor, let's go back to you. I mean, do you see that happening and being played out in Birmingham?
Yes, well, I think what we are having to do in respect of the financial challenges that we're experiencing over the next 2 to 5 years is think from first principles how we support people with the kind of the root causes of the reasons why they are coming into our services rather than dealing with the presenting need. And that feels to me to be the big public service reform challenge. We know that the King's Fund, a health charity, will say that over 60% of health expenditure these days is spent on preventable conditions for which there are no cures. We cannot carry on with a model of public services that operate in that way. We have to instead, I think, double down and invest in those preventative measures, which requires a degree of solidarity and proximity with people that we've been talking about. But that does require reform. And I do think, I agree with you that agenda has been brought into sharp relief and needs to be speeded up in the years to come. What I don't see is the kind of the political imperative from the top in this country or elsewhere to kind of recognise that's the context that we're in.
Thank you very much indeed for your question. It was really, really interesting in your lecture. Squeamish, maybe not the right word, but you don't clearly like this quality-adjusted life year concept, this qual of measuring the value of a life. However, that is the basis upon which organisations like NICE, the National Institute for Health and Clinical Excellence in this country, which is seen as a paragon organisation around the world, without it, they wouldn't be able to operate. So, I mean, how would they work? Surely if they didn't have that, it would be the person with the cutest poster or the saddest story who would get the investment.
Everything does have its place, and making specific decisions about the marginal treatment, medication, or new technology. It's also used, by the way, for road safety and other types of decisions. And with scarce resources, one does. At the societal-wide level, I don't see it as appropriate. I also don't see that it works because the trade-off, the economy-health trade-off in this extreme situation, it's very hard to find. There's no evidence of the economy-health trade-off sustaining because once you let the disease get out of control, then the reaction of people to that, you're not only underserving your citizens, you've sold a false promise on economic performance, and then you get the reaction that comes from that, which is not those are micro decisions, important, but they're micro decisions as opposed to societal-wide decisions that NICE is involved in.
Okay, let's.
But by the way, I'm not particularly impressed by the methodology and as you gather. I hold 3 passports. I think I choose my Canadian passport because on the average, the Canadian life is worth more than the European and the UK life. I mean,
Yeah.
Really? Does that make sense?
Yeah. Let's turn now to Paul Krugman, Professor of Economics at City University of New York and an opinion writer for the New York Times. Professor, your question, please.
Well, Mark, I'd like to ask you to, if possible, argue me out of the pessimism that I'm feeling right now. The overarching issue, and you've alluded to that, beyond COVID, that climate change is the fundamental place where we really need to bring values into effect. We need to get beyond just individual self-interest in collective interest. We used to say, if you asked me a year ago, I would have said that the reason we have such a hard time dealing with climate is that it is kind of custom made to play into our short-sightedness, our unwilling. It's an issue where the consequences of individual actions are very diffuse. They may be enormous, but they're very widespread. And it's also the time horizon is very long. It's the greenhouse gases that you emit now will take decades to have their full impact. But now COVID is everything that climate is not. The effects are pretty easily traced. We can actually link infections, deaths to specific parties, specific events specific actions quite quickly, and the time scale. Instead of playing out over decades, it plays out often over weeks. And yet, we have failed, actually, if we had been doing this meeting a couple of months ago, I would have talked about the United States as an exceptional failure, but now we have this terrible wave in Europe as well. If we can't do this, if we can't respond effectively to this kind of crisis, what hope is there for us being able to do the right thing for the even bigger crisis of climate change?
Yeah, I think there's a couple of things that provide some hope, some possibility, but absolutely not assurance. First, if we look at, and Sophie would hopefully back me up on this, but if we look at the experience of countries that had the more severe outbreaks of SARS and MERS and others, the recency bias that we have as individuals, the steps they took in terms of pandemic preparedness, and the seriousness with which they put in place, and I'm thinking particularly in some of the major Asian economies, have meant that they were both better prepared and have reacted better, and citizens have been more effective on that. So that's the first point. So there is always, and you know this well, immediately after the financial crisis, that's when you can make changes to the financial system that might have a prospect of lessening it. If you wait a few years, everyone will forget about the problem. So there's an element here, and that's part of the reason why I said in my remarks and made the analogy between climate and COVID about it's even worse because you're not going to be able to self-isolate from climate. It affects the whole world, and it requires this upfront investment. So taking advantage of that recency bias is one element. In this case, the bias is a good thing. The second is that there has been two other points. One is that there is this sense of solidarity and a focus which leads to a where are we going together question that is asked. And I think that blended with what the conditions we had in 126 countries now coming into this that have net zero as an explicit target. As you know, the Biden administration has indicated, the president-elect has said that that should be an objective for the United States, hopefully the U.S. joining, is to say, okay, if this is the direction we want to head as a society, not trading off climate versus the economy, but we want to get to net zero, then we organize ourselves in order to do that. And then your expertise is what are the types of policies that would have the maximum impact on jobs and growth that seek to meet that objective.
Well, let's go back to Paul Krugman. I mean, has that made you any more optimistic, Paul?
Well, I mean,
it doesn't sound like it.
I mean, the funny thing about climate is that right now the economics of drastic reduction, anyway, in greenhouse gas emissions look more favorable than they ever have.
Yeah.
Technology has been our friend, and it does not look as if actually it's a very costly trade-off. But the problems of special interests and just politics, and what we've seen is just how terrible the political distortion of science can be in the face of a pandemic that everyone can see around them. And so I'm concerned. I mean, I'll take what Mark says, that recency helps. It's a peculiar thing. You know, the U.S., just looking within the U.S., the epicenter, ground zero, was New York. And New York City is probably the safest place in America right now, in part because the the citizens of New York, most of them, not all of them, took it seriously, and they learned. And the most dangerous places are actually, in the Dakotas, where people have still not wrapped their minds around the fact that this is really, really dangerous. But it has not been an encouraging episode. I have to say that if there was one thing I thought we could deal with, it would have been a pandemic. It's got to make you worried about the future.
Okay, Paul Krugman, thank you very much indeed. We have time for one more question from our audience. Luigi Zingales is joining us from our virtual audience, a name that you're familiar with.
Professor Luigi Zingales.
Professor Luigi Zingales, a very celebrated economist in his own right. Luigi, what did you want to ask?
So first of all, Mark, I love your lectures. I think that they were very interesting, and I share your criticism of the traditional cost-benefit analysis. And I also agree that when COVID came, I think at least at the beginning, the choice was not between lives and livelihood, but was really slow down the disease and so on and so forth. But both in COVID and not in COVID, we do face trade-offs. Think about the speed limits. Investment in precautionary measures and so on and so forth.
Yeah.
We are trading off lives with either pleasure, arriving faster to a place, or money with precautionary measures. How do you resolve these trade-offs in the absence of a cost-benefit analysis?
Yeah, I think, Luigi, what I'm arguing, and I'll do it at a high level, and I'd love to drill down with you on it, is that there are certain things, there's certain circumstances where we place one objective above the others. And I talked in the earlier lecture about flattening of values versus having some hierarchy. So in COVID, in the end, it's difficult, but the health objective is the highest value. In climate, and in order to answer Paul's concerns and pessimism, my argument will be that we have to make net zero not a trade-off, but that's the core objective. And then the trade-offs come through all the other decisions underneath that single paramount objective, which is hard to do, and it goes against, you're a much better economist than I am, but it goes against our instincts as economists to have optimization, have subjective value, have everything monetized, monetary values assigned, and then calculate the optimal outcome, as opposed to, again, having a primary weighting on one element of that outcome, if that makes sense.
Thank you very much indeed. We could talk, and I know you two could talk for quite a lot longer, and I'll leave you to continue that after the programme, but that is all we have time for. In his final lecture, Mark is going to turn his attention to climate change, something that has been well signalled here. How do we create an ecosystem in which society's values broaden those of the market? That's for next time. But for now, my thanks to all of you, especially to the BBC Reith Lecturer for 2020, Dr. Mark Carney.
Thank you. Thank you for listening to this podcast. I hope you enjoyed it. In my next and final lecture, I'll be looking at how we can solve the climate crisis before it's too late. And you might be interested to know that the BBC Reith lectures by Hilary Mantel, Stephen Hawking, Margaret Macmillan, and many, many others are all available to download from BBC Sounds.